Our next panelist is State Representative Pam DeLissio.
Good evening, and thank you for having me this evening. First of all, I want to say that you know you're going to continue to do the great job that I'm assuming most people in this auditorium have done, which is continue to advocate and weigh in. So, and I'm definitely concerned, as Senator Casey said, about the repeal piece, so we have to continue to be on high alert, yes. However, I'd like to look forward a little bit. I think we're smart enough together to figure out healthcare coverage and access for our country. And that would be a universal type of health coverage. And you can look on the World Health Organization, you can look on any number of very fine websites to understand what many other countries do. And the emphasis, and this is what's always interested me, my background is in long-term care, is on prevention and wellness in addition to treating illnesses. So the more well and healthy we can keep society, the more productive we are going to be, and it just all kind of flows from there. A real use of Eastern medicine with Western medicine. Think acupuncture, think meditation. Those treatments have been around for literally millennia, and there's a reason for that. They work. So I think these are the types of things that also need to be included. Again, I'm looking forward. But everyone needs to have skin in the game. And I think that's the important part. We're all very well versed on what our co-pays are, what our deductibles are, what it may cost us in-network versus out-of-network, what our premiums are. But beyond that, do we really say to a healthcare provider, well, what does this test cost? And if you ever looked at an explanation of benefits, is what you usually get from an insurance company. It tells you what the charge of the provider was, it tells you what was allowable, it tells you what's covered, and it tells you what your responsibility is, most likely at the end of the day. And that is very complex and complicated. You know, over 30 years, almost 30 years, I've headed up 4 different businesses, 2 for-profit, 2 not-for-profit. And for that length of time, I've had to bid out health insurance for my employees, my staff. And it is very complex, and there's no need for it to be that complex. Back in 2010, when the Affordable Care Act was going through Congress, we were excited because we saw that as a step. But some of us recognized that it was still an insurance-driven product. And the fact that it was going to be insurance-driven was going to be its possible failure as much as an opportunity. So when the senator talked about not sabotaging it, I'm not exactly sure what he was talking about, but I know that over the last 5 or 6 years since this has been implemented, Congress hasn't done what it's needed to do to ensure that the Affordable Care Act could work. There's been sabotage already, and there can very well continue to be. I was listening to the radio on the way in, and for anybody to say, let it fail, and then they'll see that they should have participated in this was very disconcerting to hear. So very shortly, I will have the opportunity and the privilege, I think, in Pennsylvania to introduce for the second time on my watch, a Medicare for All plan for Pennsylvania. Has been around for almost a decade. This is not my brilliant idea. This legislation has been the collective efforts of both Republicans and Democrats. My predecessor introduced this legislation, former State Representative Kathy Mandarino on her watch, and she had gotten it from David Stile, who was a Republican House member. And I still work very closely with David on strategy and how this works. And he is very clear to me as a registered Republican that from an ideological perspective, there shouldn't be one Republican in the Pennsylvania General Assembly who doesn't embrace the concept of what this represents. It's the consummate free market. It's not government run or government operated. So we're not here to talk about single payer tonight, but we are here to talk about what's wrong with the system tonight, today, to hear from you, and to know that there can be a better future, and we need our collective commitment and vision to to make that vision a reality. Thank you.